Hello, everyone, and welcome to Asian Viewpoints with Mary Sit. When you blend ancient wisdom with modern medicine, you get integrative medicine. Our guest today combines Eastern medicine with Western medicine into a really powerful formula for good health. Dr. Bing Yu is the director and founder of WeMed Clinics in Houston. He's also a professor of acupuncture, Tai Chi, and Qigong. He's been a researcher at Baylor College of Medicine and MD Anderson Cancer Center. Dr. Yu, thank you so much for being with us.
Oh, my pleasure. Great to see you here, Mary.
Let's start with acupuncture, which I think is probably the bulk of what you do at your clinics, acupuncture. What is the science behind acupuncture and how does it work?
The science behind acupuncture actually date back to 5,000 years ago. They discover in the human body, and on the human body, we have about 700 acupuncture points, which actually named as energy points. To think about the highway, they have gas station. We all need energy. If we miss a lot of gas station on 1,000 miles,
Right.
the freeway will get in a big trouble. So very interesting thing I'm going to show you here is that if you look at this guy, that they have
Hmm.
360 points on different places, but in the back they find that's for the lung, heart, liver, gut, spleen, stomach, ovary, testes. That's 3,000 years ago they find those points, and then they find now Western medicine doctor 300 years ago they find that that's the nerve, lung, heart, liver, gallbladder, spleen, ovary, testes. The Asian acupuncture, number one, they discovered is correlated with the nerve system. Number two is associated with the circulation in blood vessel. But you can ask me, says, what are the research you discover? So what they discovered that they use Doppler ultrasound, like when we treat the knee pain and when we give acupuncture treatment, they actually detect more blood flow to the knee joint. So if a person have a headache, we can find that there are more circulation going into the brain. They also use functional MRI to scan the brain when we're treating this person with like a digestion problem, diabetes. And then they find out in the brain for the digestive area actually lighten up.
Hmm.
Very interesting. So
So
there
the Western
are
medicine sort of proves that the Eastern medicine actually works.
exactly, yeah. And now we have a lot of clinical research with a randomized controlled research to improve acupuncture is great for knee pain, lower back pain, and also improve the pregnancy rate, support in vitro fertilization, the successful rate more than 50%.
The World Health Organization has made a list of all the different conditions that acupuncture actually can help and improve, and it's just a long list. It's actually almost easier to say what can it not do, what can it not help.
Well, you're right that they discover acupuncture is proven to be effective to treat allergy,
Hmm.
hypertension, digestion, chronic pain management, help with women's health, diabetes, and
Hmm.
men's health as well too. So, we'll talk about something that we cannot help with acupuncture is more about like if a person has tumor, if a person has emergency bleeding, and if a person needs surgical procedures, they need treatment as soon as possible. And if they have major infection, they need to use antibiotics. So a lot of major emergency condition, acupuncture is not best to use, but for
Hmm.
most of the chronic condition, they are safe and effective.
Does it hurt? People who have never done it before, that's one of their big red flags. Like, I don't want to put needles, I don't want needles all in me.
Those are FDA approved needle,
Hmm.
and the needle is very thin.
It's a
Okay.
one-time use needle, right?
It's one-time use needles.
Hmm.
So if I give myself a clean on the head, see that? So it's very small. See that?
Yeah, oh, yeah, I see it now.
Okay. So
And
it's
no
very
blood.
small. You can put on the
It's
head
almost
and
like it's like a little tiny pinprick almost. Not even sometimes you don't feel anything. Yeah, I see it.
it's so
Okay.
small, this one, and the pain is minimal. But
Okay.
amazing things, it can help many, many conditions.
So in general, can you tell me how many sessions it usually takes to treat a condition? It all depends on the person's health to begin with and the condition you're treating. Is it all very
What a great,
customized that way?
great question because if it's an acute condition, person has acute headache and
Hmm.
shoulder pain or abdominal discomfort, common cold, 3 to 5 treatment, you're happy, you're good. But if you talk about the chronic lower back pain being there with herniation disc,
Hmm.
degenerative disc problems, that may take 3 months to 6 months to see 60 to 90% reduction of the symptom.
You talk a lot about the five pillars of health. Can you
Mhm.
mention that to me, what they are exactly?
First thing,
Hmm.
we want to repair the body with good nutrition.
Okay.
Number two, we want to find out where are the toxin, heavy metals, inflammation. So we want to reduce the toxin of the body. The
Okay.
third one, we want to rejuvenate the brain and the nerve system because if your nerve system are very inflamed, congested,
Hmm.
and injured, we need to use that. Number four,
Okay.
rebalance the hormone. Everyone
Okay.
has hormone, regardless you're 100-year-old, 20-year-old, you
Hmm.
still need hormone. So we can optimize the hormone. Last thing we work on relax the body with fitness.
Okay. When you say hormones, are you talking about replacement hormone therapy?
So the hormone is a very amazing thing is
Hmm.
that there is a multiple way to work on the hormone.
Hmm.
The number
Okay.
one, of course, we need to do testing to
Hmm.
have the baseline. And then with that being said, you can use conventional medicine, their hormone therapy, like estrogen, progesterones, or
Hmm.
bioidentical hormone too. Only thing
Okay.
concern is that when you use external source, estrogen, progesterone, it has a very high risk of breast cancer, may cause ovarian cancer, these things. But at WeMed with me, our Dr. Evelyn and other doctors work together. We actually can improve the performance of the body itself. They may
Hmm.
produce more estrogen and progesterone from different tissue in the body. And even this person ovary is removed, you still can help them improve.
You are certified in regenerative cell therapy, right? Tell me what kind of candidate is a good candidate for something like that.
Regenerative cell therapy is follow the FDA regulation we may use for osteoarthritis,
Hmm.
for ligament tear, rotator cuff tear, meniscus tear. That's first category. Second, for arthritis in the shoulder and the spine or in the hip, we can help on that. Now, if you talk about autoimmune disease, lupus, and
Hmm.
type 1 diabetes, that'll be very helpful. Hypothyroidism, a good indication. Lastly, it's anti-aging, like to grow hair. Mary, your hair look beautiful. Okay, yeah.
Thank
You
you.
can help grow hair, help the skin,
Hmm.
and reduce wrinkles, those things.
Let's talk about Tai Chi. You know,
Uh,
if the Facebook ads are just everywhere, Tai Chi walking, it's just everywhere. All of a sudden, it's like a big deal, and all these
right.
influencers are talking about it. You've been studying this for 30 years. It's not a fad
Yeah.
for you. You've been doing it a long time. Tell me, why
Mhm.
is it important, and is it for everybody?
Tai Chi originally from martial art is
Hmm.
for defense and fighting, protect themselves. So the movement itself,
Hmm.
it combined with up and downs and yin and yang together. So you
Hmm.
always protect on the front, always move forward and backward and keep yourself balanced.
Okay.
So it turns out now when we get older, how you generate the best energy is slower, but you let energy flow. You breathe in and out slowly. It actually can perfuse more oxygen, nutrients for the whole body. And it ended up with this person from Emory University from
Hmm.
Atlanta. They find that they can reduce 50% falling rate for elderly. So think about that. You can prevent a
Wait, the
50%
falling rate can be
fall,
reduced 50% with Tai
50%
Chi if
with
people
Tai
learn Tai Chi,
Chi, with Tai
because it's
Chi.
the balancing thing. You learn how to balance yourself, right?
Balance technique strengthens the bone in the hip and the back. It's quite amazing.
It
That's
is
first
amazing.
thing. Second thing, when you do Tai Chi, you require completely mental relaxation. So you not think about your smartphone, your computer, your book, your kids, your car. You're
Your
supposed to
taxes.
just relax
Mhm.
and get energy flow that create a clear pattern in the brain. So
Mhm.
the second research shows it is one of the best for depression, improve memory. It, it has extensive therapeutic result for cognitive function, memory, so on and so forth. A beautiful thing.
It's almost like meditation, like when you're doing the actual Tai Chi, it's a breathing thing, right? Plus, you clear your mind, it's like meditating in a way.
You are absolutely right. It is called motion meditation.
It is
It
in
is.
Chinese. Is that
It
the
is.
is that the literal translation of Tai Chi
That's
motion?
translation.
I had no idea.
Yeah.
Wow.
So you
Okay.
talk about Tai Chi,
Right.
movement, you slow,
Uh-huh.
but also you can use as energy and fighting skills. That's no problem.
So all of this sounds wonderful. It's almost a little bit overwhelming to someone who's not used to all this integrative medicine. If you had to give some advice, like 3 tips or whatever, to someone what they could do at home to be a healthier person, what would you say?
Three things. Go to bed before 10:30, sleep 7 hours. Number two, they need to eat 5 different kinds of vegetables, fruits, grains, meats, whatever they like. 5 different kinds. Okay. Number three, they gotta go outside and exercise every day. Just walk, 'cause it's very simple, 30 minutes a day. Be happy, the body's clean, they'll be much healthier. But if you have any specific medical condition, be very careful. They need to talk to either physician, their doctors, or they can check our website, wemedclinics.com with S, wemedclinics.com, and also can talk to our doctor because we combine with Western and Eastern medicine together.
Dr. Yu, you've inspired me. I want to get healthier, get rid of the wrinkles. And I'm going to do some of
Absolutely.
those 3 things. I don't go to bed before 10:30. I need to work on that. So that's good. Thank you so
Yeah.
much for your interview and for talking to us about this.
Thank you, Mary, because the information you just to give to the public will be extremely helpful, save people life. Congratulations.
Thank you. If you enjoyed this interview, please click the like button below and be sure to subscribe to this channel so you never miss a show. I'm Mary Sit. Thanks for watching, and I'll see you again in the next video.